This is Health Tracks, and I'm Peter Graber. Earlier this week, Dr. Mary Hall, chair of the Department of Family Medicine at Carolinas Medical Center, visited with Representative Susan Myrick of Charlotte. Dr. Hall discussed a number of issues with Representative Myrick, including the need for SGR reform, the importance of GME funding, and why family medicine is so critical in reducing costs and improving quality in healthcare. The visit was an excellent example of proactive advocacy on behalf of family medicine in action. I caught up with Dr. Hall for her perspectives on advocacy and why being involved and proactively advocating for the specialty is so important.
Peter Graber, I'm with Mary Hall. She is the chair of family medicine at Carolinas Medical Center. Dr. Hall, you're also very active in advocacy with not only national but local elected officials. Can you share with me some insight in terms of the importance of why advocacy is so important for family medicine?
I can, thanks. Well, I've been involved in advocacy now for several years, and the reason is that primary care is so critical to the foundation of our healthcare system. And I know family physicians are daily seeing patients who are sicker, they're getting older, and there's paperwork, and just the challenges in healthcare today in seeing patients is so challenging that I want to make sure that we solidify our workforce for the future. And I've found that actually meeting with our congresspeople and our senators, they're very open and want to hear about the issues, and we're the ones who can explain it to them. So I wake up every day wanting to make sure that we have a workforce for our future in this country, and the way to get that done is by talking to the people who are responsible for the law of this country.
As part of the visit, I also had the opportunity to ask Congressman Myrick several questions, one of which was the importance of stabilizing Medicare physician payment rates. She had this to share.
And nationally, family physicians are certainly the main source of primary care for the nation's Medicare population. There's a huge need to stabilize Medicare and the physician payment rates longer term. Any perspectives on that?
There's no question. I mean, this is a tremendously huge concern to all of us, because we know, I have doctors tell me every day that, I'm thinking of quitting. I mean, that's the worst thing that can happen. But when their reimbursement rate for treating the patient is so much less than what their actual costs are for doing that treatment, I mean, they can't stay in business. No business can stay in business if you aren't at least covering your cost, and you hopefully will make a little profit. So it's a big concern, because we've got to deal with that long term. We've put Band-Aids on it for so many years, and Band-Aids don't work anymore. We've got to find a long-term, in effect, fix for this problem.
For more information on how to participate in AAFP's Key Contact Program, see the Policy and Advocacy section at aafp.org. For NC Health Tracks, I'm Peter Graber.